welcome back to Midwife Par Excellence. I'm your midwife, Bernard. Today I will be talking about a topic that it is not often thought about, but once we're finished talking about it, you will understand that this is a very important topic in today's society. We're talking about cervical incompetence. Many women have been having recurrent miscarriages and undiagnosed. However, you want to start thinking about this condition that you could be having cervical incompetence and not aware that this is what is happening. So today we're going to be going in depth on this condition. So stick and stay with me. So if we're going to talk about incompetence, we need to know what is a cervix. And it is the lower part of the uterus. All right, it is at the end of the vagina, so that's the pouty, dimple-looking, pinkish organ that is found between the uterus and the vagina. It opens, it thins out, and it opens during childbirth to allow the fetus to pass through. It also opens to allow menstrual flow to pass through when it is that time of the month. All right. It is also where we do take our samples from to test for cervical cancer when you're doing your pap smear examination. So, cervical incompetence, or also known as incompetent cervix, is a condition where there is weakening of the cervical muscles, causing premature labor or possible loss of the pregnancy. All right. So, who are the persons who are at risk for this condition, cervical incompetence? Those persons who have had previous miscarriages before, if you have had any surgical procedures being done to your cervix before, if you have had any history of premature rupture of membranes or premature birth in previous pregnancies, or if your doctor tells you that you're having a short cervix which is less than 25 millimeters. All right. So what are the symptoms you should be looking for if you are pregnant and you're wondering if you might be suffering from cervical incompetence? You're having a sudden back pain. You're having pressure or heaviness in the vagina. You're seeing any form of bleeding, you want to be assessed for same. All right? Or if you're having contractions, you know it's not time for the baby to be born, but you're having contraction and that is on and off pain. Anywhere between every 5 to 10 minutes, and there's nothing you can do about it. Please head to your nearest healthcare provider, all right, to be assessed. All right, so if you are confirmed as having cervical incompetence, how can it be treated? Now, your doctor would want to do bi-weekly ultrasounds anywhere between 16 and 24 weeks. So every 2 weeks, you're going to be doing an ultrasound to monitor what is happening. All right. You can also have a cerclage put in, and that is where they stitch the cervix closed. And this must be done between 12 to 14 weeks of pregnancy. All right. Yes. Right. So once you have been confirmed as having cervical incompetence, there are some things that you want to do at home to make the prognosis of your pregnancy a better one. So you want to stop all sexual activity. All right, you want to listen to your doctor, no excessive exercising or physical activity, and you also want to be, you will be placed on bed rest, and you must honor same. All right, so little to no movement up and about, all right, as best as you can, because you want to keep the weight of the baby off the cervix, and that's the reason why you are placed on bed rest or limited or no mobility at that time. So we were talking about her cerclage earlier, where we are saying that this is a stitch that is used to close the cervix. However, there are some persons will not be privy to this stitch. All right, and these are persons who are carrying 2 or more babies in the uterus. If there's uterine infection, if on ultrasound the life of the baby is thought to be in jeopardy, or if your water has broken, and that is rupture of your membranes. All right. So how is the cervical cerclage done? General or local anesthesia is used to minimize the pain and discomfort of the procedure. A speculum is used to open the vagina to view the cervix, and the stitching is done by your doctor. Alright, so you will have in the cervical cerclage until about 37 weeks of pregnancy, or until the mother goes into active labor, or if there is spontaneous rupture of membranes. then it will be removed. All right. So for those ladies who are constantly having recurrent miscarriages, you want to know that on your next pregnancy, you want to start seeing your doctor before the 12th weeks, because remember, your cerclage has to be placed in situ 12 to 14 weeks. It can go up to 24 weeks, but the prognosis is better if it is placed inside 14 to 16 weeks of pregnancy. Okay, there is hope for you. Please do not be discouraged. I hope you enjoyed this presentation. And remember, I am here for you. Thank you.